This segment is sponsored by Stec & Stein's Cosmetic and Family Dentistry.
Welcome back, everybody. Look who's back with me.
Yeah, welcome back.
Thanks for having me back,
Yeah.
Dr. Jacob Steins from Stec & Stein's Dentistry here in Grand Island. And it's been a while, but boy, do we have a lot to talk about.
We do.
Because we're covering so many changes. Just
Yeah.
since the last time we were here, so many new things have come into play. And so that's what's really cool.
A lot of cool things that we've been getting ready to roll out for a while and then finally have up and going, and we're really excited about it.
Yeah, and this first one, I mean, he was kind of prepping me a little bit here this morning. We're talking about teeth alignment.
Yes.
And it's a lot more detailed than you would think,
Yeah.
besides just biting down and thinking your teeth are aligned, right?
Yeah, absolutely. I mean, anybody who's ever had some dentistry done, the thing that they remember is we have you bite on some paper. And what we're looking for is whatever we've put in there, if it's a filling, if it's a crown, whatever type of fix that we've put in, we want to make sure that it's aligned with the rest of your bite. And what we mean by that is we want to make sure you're not putting any extra pressure on the new dentistry that could cause symptoms with the tooth or cause a problem with that. And that's what people have seen in the past. They see the little colored paper, they bite on it. That shows us where we need to adjust if we need to. But things have gotten a lot more detailed, and some of the cases require just a little bit more of an in-depth look.
So when you say adjust, you mean like put more on top of a tooth, or how do you
Usually we mean the opposite way. So if we were to put a filling in the tooth and you bite down and you bump, we use the term bump into that, or you can feel like that is too tall, then what we mean is we were able to adjust that. We're able to take that filling down a little bit so that the neighboring teeth line up and make the same type of contact.
What if you have to make it higher?
And that's usually something a patient won't notice. Like if something's like too low, then they're going to think that everything's okay. Typically what we're looking for in a bite is to make sure that whatever we've applied dentistry isn't outside of the range of the neighboring teeth.
And for an example with this here, you said when people bite down, and sometimes their front teeth might go way forward.
They can. You know, you've got all sorts of muscles that attach to this lower jaw, and you know, as your jaws are closing together, the way that the teeth sit in there and the way the muscles work is some people actually run into their teeth in really weird angles, and we see this happen. Teeth are really resilient, and some of these things take years to show problems. But when we start to see people wearing down dentistry at an accelerated rate, or they're chipping their teeth off at weird angles, then we have to take a step back and think, okay, is there something that's out of alignment that's causing this portion of their teeth to get more use than maybe it was designed to do? And we've now got a tool to help us do that.
Yeah. I want to show some of the things on the computer you were showing me earlier about how this can tell you with a patient when your teeth are biting down, what hits it first. This is amazing.
Yeah, absolutely. So just for example here, we had a patient and they told us, hey, when I bite, and what we're looking at here is we're looking at a bird's eye view of their teeth, okay? This would be their left side and this is their right. This patient told me, every time I bite down, this one tooth on the left hurts. When we got out our scanner, it's called a T-scanner or a bite analyzer, I had them bite down, and you can see on this left side, when we see red and orange peaks, that tells us that there is way more force in one area than there is everywhere else. So what we do with that is that allows us to be a lot more accurate. Whenever we make an adjustment or I adjust a tooth to take the force off, I know exactly where I need to do that.
Wow. Yeah.
And what you'll see with this patient here is we took this and we made the adjustments that we needed to in that certain area. And after we were done, we rescanned to make sure everything's like we want it.
Wow. That's
and
all,
everything's
the red
back.
and orange is gone.
Greens, blues, those types of colors, those tell us that he's now hitting evenly in those areas. Now, a lot of patients will notice instantly that their bite feels better. Anytime you've got the teeth sharing force, they're going to be a lot less prone to sensitivity and problems.
What is, if your teeth are not aligned as well as we see in that photo right there, what does that do to your muscles in your jaw?
Yeah, you know, everybody's different. Some people, the only symptom you see is broken dentistry or broken teeth. Other people, whenever they've got misalignment, especially in their molars, they're a lot more prone to joint pain. We use the term TMD, temporomandibular dysfunction, or pain in the jaw joints, noise in the jaw joints, headaches, pain in the muscles. And so a lot of those people we look at, as a part of treating the joint pain, we need to make sure that there's nothing standing in their way to get their bite aligned so that those muscles aren't paying the price as well.
How does someone know if they need an alignment?
Yeah, so great candidates for this are people who have had crowns that just haven't lasted as long. They've been breaking fillings, their teeth are chipping off at weird angles. Those people who've had kind of those types of frustrations in the past. A lot of people who have what we call a lot of wear on their teeth or a lot of enamel loss over time. And even patients who are developing a lot of chronic migraine headaches, pain in the foreheads, cheeks. We all use this as a portion of our workup on a patient to see what we can do to help them.
This is, I mean, I don't know anything about, I do know a lot more since I've been coming here. This is the happy dentist place to come. Nothing here that they won't explain or that they don't know. And the technology that you're able to share with your patients is amazing. So thanks for sharing. People need to come and check you guys out here in Grand Island.
Absolutely. Yep. Give us a call, 308-382-4440. Come see us.
Perfect. Well, we will put all that information on our website as well.
Great.
So Dr. Jacob Steins, thanks so much.
Absolutely.
Appreciate all the information.
Absolutely.
And we'll be back in just a moment. Don't go away.